Hello there, it's Amy. Today we're going to talk about MARs and TARs and how to document on them. First of all, a MAR is really a medication administration record. It's legal documentation of all the medications administered to a patient. Nurses must sign off all medications administered to each patient every shift. It includes all daily and PRN medications. The MARs must match the plan of care, all the supplemental orders, and medication profile. MARs are printed out monthly. They are located in the patient's home binder and handed in once a month once completed, and they are added to the patient's permanent record. Here is an example of one of our medication records. Each page of the medication administration record includes the patient's name, the medical record number, the month and the year for the administration of meds for that month, the date of birth, the doctor, and the phone number to the doctor, the start of care date, all the patient's allergies, and a few of their diagnoses will be listed at the top. The MAR is broken down into different sections. Each section includes the start date, medication name, dose, route, frequency, and time. And I gave you an example here. For the start date, it's listed under here. You can't really see it in this picture, but it's there. You can see the edges. And the medication, the complete order, is in this box here. And then the times are listed next to it, so you know exactly what time the patient's supposed to get that medication. Next to time, there's a few columns. So say this is the month of April. Here's the dates, the 1st, the 2nd, and so on. Underneath all these rows here, you go straight across, and this is how you sign it off with your initials or some of the symbols as directed in the key. Pages are divided into daily medications, PRNs, well and sick plans, and a comment page. Every page will include a space for the nurse to sign an initial. Signatures must be legible and they must be on every page. So you can see, you can put your initials and your signature, and there's plenty of spaces for all the nurses in the home. Every house has a MAR key, and it's actually in a laminated section in the binder. So the key to the MAR, just in case it isn't listed on the MAR sheet itself. H is for a medication that's held. X is for a medication not given. R is reported by caregiver as given by the caregiver. Your initials mean the medication was administered by you. Then there's injection codes for anybody that needs an injection. The last page of the MAR is where you must put all your reasonings for your held medications, your medications not given, and for the reason, PRN, given, and response. So whenever you give a PRN, you need to write in that you gave it, why you gave it, and then it needs to be a reassessment underneath saying how the patient responded to the medication. If a medication is discontinued, you must use a yellow highlighter to shade in the medication order, initial, and date it. So as you can see here, this patient had an order for Vimpat, but it was discontinued on 3/10/19. It is yellowed out to indicate that we are no longer giving this medication. When a new medication order is obtained, the order must be verified by your case manager or on-call supervisor. Once this medication is verified, the medication order can be transcribed onto the MAR. Extra blank MARs will be available in the patient's binder for you to do so. When you're transcribing the new medication order into the MAR, you must write the complete medication order. Don't forget the components such as start date, medication name, dosage strength, dosage form, route of administration, frequency of administration, duration of therapy, and indication for use on all PRN medications. Report change to oncoming nurse and write a communication in the communication section of the patient's binder so this really stands out for the next nurse. The next thing we're going to talk about are the TARs. So the TARs are the treatment administration records. It's also a legal documentation of all the treatments, interventions, orders, and that are administered to a patient. Nurses must sign off on the treatments administered to the patient every shift. All treatments are ordered in your patient's plan of care. Treatments are located in the section number 21 in the plan of care. All treatments must match your patient's orders in the plan of care or any supplemental orders that came in after that plan was signed by the doctor. TARs are also printed out monthly, and they are also located in the patient's home binder and handed in once a month once they're completed, and they are added to the patient's permanent record. Here's an example of the treatment administration record, and it looks just like our medication administration record. Each page of the TAR includes the patient's name, the medical record number, the month and the year, the date of birth of the patient, and the patient's doctor and the doctor's phone number. The TAR is broken into sections as well. It'll have the start date, as you can see here. It'll have the treatment order, and then you'll have a time column so that you know exactly what time the treatment is ordered for. The example here is the start date is 10/3/2018. The treatment or intervention is empty and clean suction canister each shift with soapy water. So once that is completed, the nurse can initial in the box, or if the parent or caregiver has done the treatment, then you would put an R for reported. The columns also indicate the days of the month, and the rows are the boxes for signing. Every page must include a space for the nurse to sign an initial, and signatures again must be legible. Each page has this little box you need to sign with your title and put your initials. So again, if you are discontinuing a treatment or an intervention, you need to use your yellow highlighter, write it, shade it in, write your date, write it's discontinued, and your initials. If a treatment is not done, circle an initial if not done, and document reason and narrative. When a new treatment order is obtained, the order must be verified by your case manager or your on-call supervisor. Once verified, the treatment can be transcribed onto the TAR. Extra blank TARs will be available in the patient's binder. It's the same procedure as if it was a new medication. So important information about the TARs are all treatment interventions must be signed off on the TAR. These are your orders that must be documented on every shift. Everything written on the TAR must match your plan of care or supplemental orders. If you have any questions, reach out to your case manager or your supervisor on call.